Hello everyone, I'm Corlez,
And I'm Naomi.
and we're from Fighting Through Our Pain TV. Joining us now is Dr. Thomas Harrington.
Hi, everybody.
So today we're going to talk about several things. Today we're going to talk about how some complications due to sickle cell with strokes and
Different organs, with the eyes, anything Dr. Harrington can talk about with us today.
So, well, there's many different subjects you can talk about the sickle cell. You talk about organs, you talk about stroke, you talk about chest syndrome, kidney problems, because sickle cell is a disease that where the blood vessels get blocked by abnormal red cells that cause inflammation and blockage in all the different organs of the body. So the ones you feel, the ones that bring people to the hospital most often, are pain in the bones. But there's damage that's happening or can happen in any organ of the body, from your ankles with ankle ulcers to strokes and everything in between. So it really is a relentless condition where blockage of blood flow leads to tissue damage and injury and pain.
so why is it that strokes, why is it that sickle cell patients are more likely to get strokes, I guess?
Well, they found early on, kids tend to get strokes. Anyone can get a stroke, but kids tend to get them at an early age, and they found that the narrowing of the blood vessels due to some vasoconstriction leads to really tight flow through the arteries of the brain. In fact, most kids with sickle cell have undergone many different, what they call transcranial Dopplers, where they do ultrasounds of the main artery of the skull and the brain to see if there's tight flow through that area. If they do, they're very high risk for strokes. They know that people who have these very high speeds have it because the blood vessels get tighter and tighter, and as they get smaller, the cells flow even faster through that area. So a fast speed means a very tight artery, and people who have these tight arteries are the ones where they can get a complete occlusion and a major stroke. And so that's the screening for that is one of the major advances in care and studying for sickle cell, and probably saved many children from strokes and adults dealing with strokes as children. So it's been a major benefit, but the reason they get it is the injury to these vessels causing them to get tighter and smaller, and then ultimately just occlude completely. So patients who have these high speeds, when they get the transcranial Doppler, when they get the ultrasound of their arteries, they get put on chronic transfusions with their very high speeds to try to prevent them from having even their first stroke. Obviously, if you have a stroke at an early age, the next step is to do transfusions for several years to many years after that. So if people have strokes as children, they get started on transfusion therapy to try to prevent further damage and try to improve the blood flow to that area that's injured. But in people who have the high speeds due to the near occlusion there, putting them on transfusions from childhood for years and until they reach adulthood almost can prevent them from having a stroke. And is a major study that Dr. Pegalo, who was a major,
Who's our doctor?
Yeah, he was.
and a major figure in sickle cell care from pediatrics. He was one of my mentors and colleagues until he died in the early 2000s. He was part of those studies called the STOP trial, which was to check transcranial Doppler speed and identify who was likely to have a stroke, and then put them on therapy to prevent strokes.
Yeah, I remember I did that study back at the trailer.
Yeah,
Yeah.
I know I did a lot of MRIs
Yeah.
and scans, but I don't know if I did that study.
No, they had a special, a woman tech from neurology would come there every
Tuesday and
week.
Thursday,
Yeah,
something like
Tuesday and
that.
Thursday, she would come there every week, and they had a little examination room, and just bring all these kids in with sickle cell and transcranial Doppler speeds, and they would determine how fast. If it was very fast, that meant that it was a tight, catch. Just imagine if you have all the traffic trying to shoot through a closed off road. They have to go real fast to get the same speed through there. Well, that's kind of how it is with the arteries.
Oh, good example. Thank you. I understand what you're saying.
So the vessels that are under very high speed, those are the ones that are associated with future strokes or risk for stroke, and putting those kids on transfusion therapy appears to have prevented a lot of strokes in sickle cell disease, and preventing brain injury is a great thing.
Now, how do you treat someone who has had a stroke that's a patient?
Well, someone who's had a stroke, initially the treatment is, again, to go back on transfusion therapy to try to get the cells flowing through those vessels to be healthier cells that don't cause more occlusion. So patients who have strokes will be put on a chronic transfusion regimen, either a simple transfusion or in some cases a recurring exchange transfusion to try to get their sickle cell count low and have more normal cells flowing through there, because sickle cells they don't just block because they're kind of oblong shaped cells that close the blood vessel. They actually interact with other cells. They interact with blood vessel cells and cause them to get inflamed. They interact with platelets and white cells and cause a big inflammation. And these inflammatory responses cause vasoconstriction and decreased oxygen. So that happens in the brain, happens in the lungs, happens in the bones. So it's not just the red cells that are misshapen and causing a problem, it's the misshapen red cells damaging the white cells and platelets and blood vessels and everything else. So it's a one mutation, simple mutation that affects the red cells that affects everything else. So it's very complex.
Sorry.
And the treatment, you asked about treatment for strokes, one of the signs, one of the criteria for consideration of a bone marrow transplant is a stroke at an early age. There's several different findings that we can think of kids who would be good candidates to get a bone marrow transplant as people who have strokes, or people who have very high TCDs, these transcranial Doppler speeds, people who have dactylitis, which is this painful inflammation of bones and hands, people who have recurrent chest syndrome. All these people have a major complication at an early age. Those are the ones we try to see if they can get a bone marrow transplant. So bone marrow transplant it would be ideal treatment if everyone could get it, it'd be great, but it's not possible for everyone, so we have to come up with alternatives.
And that's not an easy thing, right?
Yeah, a bone marrow transplant has your cells, your immune system can react against the cells that you get from someone else.
Yeah.
So you want to get someone who is as closely related to you as possible. So ideally, it's a matched brother or sister, and a matched brother or sister who have kind of similar immune system. You won't react as much, and they won't react as much against you. So it's not this battle of the immunity, but there's progress being made, and because sickle cell is not like leukemia, where you have to eliminate every single last cell, some more general types of bone marrow transplant where you might have allow some of the cells to survive and let them slowly replace the patient's marrow. Those are future options, and even haplotransplants where you get a transplant from your parent or one of your parents or someone who is not a perfectly matched sibling. These are also possibilities, but those are all kind of in research mode right now.
For this part, we're going to say thank you to Dr. Harrington for letting us hear more about strokes and for
the eye retina. And remember, we continue to want to hear your stories, so reach out to us. We'll be in contact to you, and remember to continue to fight through your pain.
Thank you.